All right, welcome. This is Celebrity Pharmacologist, and today let's look at the classification of antihypertensive. Lately we have been discussing about hypertension and drugs used in management of hypertension. So today let's look at a broad classification of drugs used in the management of hypertension. If this is your first time of coming across a celebrity pharmacologist, please do well to save this video, like and share this video to those that are in the medical school, those that are in medical practice, or those that are into pharmacy. So they know how to use drugs and know how to use medicine in management of what hypertension. Looking at the classification, the first class we have here is the diuretics. The diuretics helps to reduce blood pressure by helping the body or the kidney to remove excessive sodium and water from the body. So when there is lesser fluid in circulation, that means the blood volume will drop or will reduce. And when this volume reduces, then the blood pressure will definitely reduce. Take for instance, we have this is a vessel. Let's say this is a blood vessel, and you have like, let me just use number for example. Let me say we have three blood. You see, let me say this three blood wants to pass through this vessel. You see that if three of them tries to pass through, they will struggle. So there's going to be struggle for them to pass through. But what diuretics will do is that it will help the body to remove some of this fluid. So let me say it now removes like one or reduce it to this extent. Then you see that they can go easily. Then there will be what we call reduction in the peripheral vascular resistance. And when this reduction happens, then the pressure will definitely what come down. Examples that we have is the hydrochlorodiazide. We also have that's the thiazide. We have the impidamide, and we also have furosemide, spirolactone. There are so many of them. I want you to know that in management of chronic hypertension, impidamide is actually very effective and potent compared. There are so many clinical reports that impidamide is better than hydrochlorothiazide in management of what chronic hypertension. Though there are cases where you use them, you have to know the cases when you use them. Then another class we have there is the angiotensin converting enzyme inhibitors. That's what we call ACE, angiotensin converting enzyme inhibitors. What do? They prevent the formation of angiotensin 2. Angio they prevent the formation of angiotensin 2. Angiotensin 2 is a potent constrictor, sorry. It's a potent vasoconstrictor. Remember I said that when there is constriction, then there will be increase in pressure. But when there is dilation or relaxation, then there will be reduction in blood pressure. So angiotensin converting enzyme, it will prevent angiotensin 1 from becoming angiotensin 2. And this hormone here is a potent vasoconstrictor. So when there is no vasoconstrictor, then the vessel will what? Dilate. And when there is dilation, automatically the blood pressure will reduce. Typical example is the captopril. Yeah, we also have the popular example, we also have the lisinopril. Most people, even we have the ramipril. These are drugs. If you just see the pril, they are talking about the what? ACEs, the ACEs. Please don't go and be cramming names, because if you cram names, you might miss it. Some drugs that are not in this class they carry the same name. So captopril. I think most times most people the captopril is taken like twice daily. That's BD. While lisinopril it's once daily. It actually captopril drops the blood pressure compared. It drops blood pressure very fast compared to lisinopril, but most clinicians prefer lisinopril because of the lesser side effects, and it's how it's very easy to adapt, because when you take a drug that you're taking just once a day, it's easier for most people. Now another class of drug, that's the number three, is the ARBs, which is the angiotensin receptor blockers. What does this drug do? It's unlike ACEs that prevent the formation of angiotensin 2. It does not prevent the formation of angiotensin 2, rather it prevents angiotensin 2 from binding to its receptor. Angiotensin 2 binds to receptor at the AT1 substrate 1. So when before a hormone or yes, before hormones can carry out its effect, it needs to bind to receptor. Before most drugs carry their effect, they need to bind to their receptor. So this angiotensin 2 needs to bind to a receptor, needs to marry to its wife before it carry out its effect. Angiotensin receptor blockers will stop that action. So that means there will be angiotensin 2, that's the vasoconstrictor, but it will not be able to carry out its effect. Example is the losartan, uh, valsartan, telmisartan. Those are the typical ones, the common ones that we have in Nigeria. And I also want you to know that telmisartan is very very common. It's the newer, should I say, it's the newer version compared to others, and it's very very effective for hypertension, in management of hypertension in patients with diabetes. So when someone is having diabetes, permethazine is actually very, very good in such patients. I want you to understand then the fourth one is direct renin inhibitors, and a typical example is the aliskiren. You see, if you watch very well, number two, number three, and number four, they are like neighbors. You see, renin is the first enzyme when in the RAS system. Is the what first it does enzyme is that it will just prevent the formation of the so-called angiotensin. So angiotensin at all will not just take place. I want you to know something that angiotensin as a hormone, it has some benefits in the body. So with time, we are going to look at the advantages of these three brothers or these three sisters. We are going to look at the advantages. Which of them is better? Which of them is better off to be used? Because the angiotensin that they are inhibiting, it's useful for the body. So we actually look which of them is better. Then the fifth one is the calcium channel blockers. The calcium channel blockers for me is supposed to even be the number one because it's widely used, easy to adapt, and it's very common in most African nations. It works by inhibiting calcium. Calcium used to cause vasoconstriction. So what it does is to block calcium in most of the vessels, and that will now cause a vasodilation. A typical example is the amlodipine. Amlodipine is widely used and is very common. It's very, very effective. If we classify them again, though, well, let's just take it this way. So it's very, very effective. Now, we've made a video about amlodipine and nifedipine. Please, you can go and watch that video so you know how it works. So that's just the two we'll touch in this calcium channel blockers. So we'll touch the rest as time goes on. All right, the sixth one is the beta adrenergic blockers, and a typical example is the what propranolol, metoprolol, and atenolol. There are so many of them, and how do they work? They act by reducing the heart rate. They reduce how the heart beats and also reduce the force of contraction. So when this happens, that means the blood pressure will definitely come down, and this will help to reduce or prevent heart failure. So you see that you need to know how these drugs works before you know which of them to give in different cases. So when we're talking about fluid retention or we need a vasodilator, it's not actually the best option. I'm talking about the beta adrenergic blockers because they are actually good or better for cases, better in cases like angina pectoris. So when we're talking about fluid retention, we need vasodilators. It's not the best option, but it's very, very effective for other cardiovascular diseases. We also have the seventh one, which is the alpha and beta blockers, also called the non-selective adrenergic blockers. A typical example is the labetalol. Labetalol is very, very effective. Right, looking at our next option is the alpha adrenergic blockers. The typical example is the prazosin and doxazosine. How do they work? They just block the action of the noradrenaline in the alpha receptors. And when this happens, there will be what we call vasodilation. Then number 9 is the central sympatholytic. The central sympatholytic acts in the brain by reducing the action of the sympathetic nervous system or the sympathetic nervous activities. So what this is, a typical example is the methyldopa. What this means is that in autonomic pharmacology we have the parasympathetic nervous system and the sympathetic nervous system. And we said in our previous biology, we said the sympathetic nervous system is the one that prepares the body for flight, for fight, or fear. So what it does, and when when the sympathetic nervous system is being activated, it will it will increase the heart rate. And when there is increase in heart rate, that means there will be high demand of what? Flow of blood. So or flow of fluid all through the body. So this class of drug will reduce that effect of the sympathetic nervous system or the sympathetic activities in the brain. Then the last but not the least is the vasodilators. So we have the arteriolars and what the arteriolars plus venous. A typical examples of the arteriolars is the hydralazine, and we also have the sodium nitroprusside. With this, we have come to the end of classification of antihypertensives. So if you like this kind of video, don't forget to drop your comments. Tell me the drug you want me to start with, because we are about to start comparison. Tell me the drug you want me to start with. And most people, how they combine drugs. I think we are still going to talk about drug combination. How we said that antihypertensives is very efficacious, or they work better by synergism when you combine two or more drugs together. Take for instance, if you take one diuretics, you take one ACE inhibitor, and you take calcium, one of the calcium channel blockers, you are going to do a very good job in the management of the high blood pressure. When you are in terms of chronic high blood pressure, that kind of combination is very nice. So we are going to look at combinations like diuretics, ACE inhibitors, and one of the calcium channel blockers. Then we also look at uh, diuretics, ARBs, and calcium channel blockers. Can also look at other ones. We will also look at management of hypertension in pregnant women. In pregnant women, you don't just give all kinds of drug. You don't just give all kinds of drug. You select the ones that are less toxic. Thank you very much. If you have watched this video to this end, please don't forget to save this video. Tell me the drug you want me to talk next. Thank you.